Dr. Tnomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi in India. Today we are going to talk about something which is very controversial. Most of the time people are looking at root canal treatment as a failure treatment and they are opting out for implants, and I have spoken in detail about the hawks of telling like that and things like that. So please look into this video wherein we talk about root canal failures, how to why it happens and how to correct it and things like that. So please subscribe my videos and like it and share it to your friends, so that if you like it, please share it to everyone so that they'll also understand, they'll also benefit out of it. So root canal treatments are done by experts in endodontics and things like that. So but there were a time where there was no technology proper to do the access the cavity in detail, or to access the canals in detail, or to find out with x-rays as we are using right now, the digital ones and things like that. It was not there. So there are root canals which was done around 40 years or 30 years back, which comes very at my practice it comes very regularly that there is a root canal treatment which is not filmed properly or something like that. The doctor's fault. So we'll talk first about the doctor's fault. What happens? So there are three parts to the root canal treatment. If you look at it as a general point of view, there is the access preparation, wherein you make an access into the nerve chamber itself, and then we clean out all the nerves and the debris and the food and the bacteria out of it. So we have to make a proper access. So so if the access preparation is too big, or if it is too deep that it went into the roots, then it can cause a if it is too big, the tooth can fall apart, or if it is too deep, it can go into the roots, between the roots, and if it goes into the bone and things like that, it is much more difficult to correct it. So that is what happens if a doctor is not experienced, or if the doctor doesn't have enough technology to do the right way of finding out the canals and things like that. The second part is that he misses a canal. There may be multiple canals in the tooth itself, like 4 rooted teeth, sometimes it is 6 rooted teeth, sometimes it is 3 rooted or 2 rooted. So if the doctor cannot find an access into a canal, then that canal can be infected, and then it can cause pain and infection later. So that is one more reason for it. Then improper cleaning, the disinfection and the chemical cleaning of and the mechanical cleaning of the canals has to be proper. If it is not like that, then also it can cause. Then the last one is the filling part. When you fill it with gutta percha, which is the most common, the heated gutta percha, or the cone gutta percha is what is used in an ideal situation in a root canal treatment. So if the filling is not proper, if it is not hermetic, or if it doesn't prevent the bacteria from retrograde infection, then that also can cause infection and failure of the root canal treatment. So these are the doctor induced issues of root canal failures. Now there is a patient induced failure for root canal. Why is it? Because as we are already, most of the patients will have a decay, which is actually triggering for the root canal. So what happens is the patient already has weakened the tooth structure. Now we have to make an access, which is to be ideal. So that also weakens the tooth structure. So we have to go for, most of the time we have to do a crown. And when we tell the patient, oh, they'll I'll come back for the crown. So most of the time they forget, because there is no pain, there is no sensitivity, they forget about it, and the D-day comes when he bites on something which is hard, and then the tooth breaks off. Once it breaks, and if it breaks in a not favorable way, so then we'll have to extract the tooth, and then we'll have to replace the tooth with a bridge or with an implant. So that is also one way of losing the tooth. So the second part is they don't maintain it. If they don't maintain, because today we are having most of the food which is actually cooked. So we need a professional cleaning of tooth once a year, or at least twice a year is ideal. At least once a year you have to come and do a professional cleaning. If they don't do it, you might end up with a periodontal issue, and then the tooth starts shaking, and then it might go. So that can happen even with a non-root canal treated tooth, but this also is a cause of failure of root canals. And there is another reason where it can happen is that there is another caries which is developing on the same tooth under the crown, even if they wear a crown. If the gums go a little down, and then if there is a caries which is developing, most of the time the patient will not know the caries is developing, as there is no nerves, there is no trigger, alarm triggers or anything like that. Then suddenly there is a cavity. So that is why as I told you, twice a year you go to the dentist, or at least once a year go to the dentist, have a checkup done whether there is any cavity forming under the crown or on the sides of the tooth, because the bacteria doesn't know that you have already treated with root canal treatment, so it will eat through the tooth and then it finishes off. So that is also one reason wherein you can suddenly you might feel that the crown is broken and the tooth is gone. So that also is a reason for root canal failures, wherein the tooth itself is broken off and then you may not be able to correct it. But that also may be correctable by the posts and things like that. If there is, so we'll talk about the correction part also now. See, if there is a doctor-induced problem, like if there is a underfilled canal, then we can do it. If there is a canal which is missed, then we can find it out using RCTs and proper technology. So that also can actually correct that one and save your tooth. Then if there is something like a fracture of the tooth, if it is favorably fractured, then you can actually use a post and correct it. Or even if there is a caries and one part of the tooth fractures off, then also we can do a post and correct it. If everything fails, if the tooth has to be extracted, please make sure that we correct it with a bridge or an implant so that you still have. So root canal treatments are, I have in my practice, this practice was actually started by my dad. In the clinics, 55 years, we have seen root canals which have survived 40 years and 30 years, like that. We have seen old people coming and saying that your dad has done a great job. The root canal treatment is still surviving and it is actually being used for chewing. So we are happy to say that a root canal treated tooth can actually serve you for a lifetime. But there are instances wherein there are some cases wherein they come and tell that there are pain, and sometimes what happens is the next tooth is infected, but the patient knows that there is a treatment done in one tooth, so they always think that it is the tooth which is treated which is giving the trouble, but most of the time it is a tooth which is next. Or even sometimes the patient complains of pain on the left side, and we might have treated on the right side, and he might have forgotten because it was done 10 years or 15 years back, they know only that there is a tooth which is treated. So they have the tendency of telling that, okay, there is a pain and that should be that tooth. So that is also happening. So please go to the dentist, check it out whether the root canal is a failure, or is it anything that can be repairable, or can we upgrade the root canal treatment which was done say 20 or 30 years back with a lower technology to the higher technology fillings and things like that, so that it doesn't give any pain. So root canal treatment is not a bad treatment at all. We have replaced most of the chemicals, and it is much more less caustic and less traumatic to the patient. It is single sitting and things like that. So even RCTs have become single sitting, and we can remove infections, we can find out the canals, and we can do a root canal treatment which can serve you a lifetime. Even if it is in the mode of failure right now, we can actually correct it. If it is a failure, please make sure that you replace it. So, so like that, I'd like to tell you that until you are hungry, you need to have teeth to chew. So until the hunger goes off, you need to maintain your teeth. And root canal treatment is an ideal way to prepare and protect the tooth from a fracture and things like that. So, and the infection can be removed effectively and protect whatever God has given to you, so that you can smile and chew until you leave this earth. So have a great smile, have a great time. Dr. Tnomas Nechupadam from Nechupadam Dental and Marine Drive Coaching.